At Northwell Health, we're 61,000 people who see healthcare differently. And this is how we look at esophageal disease.
Esophageal diseases are broken down into two categories, benign and malignant. Benign or non-cancerous problems with the esophagus typically give people a difficult time with eating and swallowing food.
One of our most basic instincts is to eat. When somebody has esophageal disease, it may not necessarily be that simple. With this come not just malnutrition, a lot of psychological changes. We approach the patients from every different aspects.
We get that we're not just treating esophageal disease, we're treating your esophageal disease.
It's very important to define what the problem is when you're dealing with esophagus problems. You have to know exactly what it is. You have to know exactly what part of the esophagus the problem is located in, and you have to know exactly what's going on if you want to treat it properly.
We have the luxury of being able to tailor the intervention to the patient's needs. It's not one approach fits all.
When a disease turns your life completely upside down, you need a complete list of options.
We have everything one might need when it comes to the needs of thoracic surgery.
There are many options available for treatment of esophageal diseases. Some of them may include treatments done with a scope through the mouth, and some of them may include operations that are done either through the abdomen or through the ribs. It depends on the person's problem.
The advances of robotic surgery been such that it enabled us to practically address all the aspects of surgery in a minimally invasive fashion. It allowed us to get to a much more difficult to get to areas of the body. It allows us to do much more precise interventions and better outcomes on a long-term basis.
There's quicker recovery time and smaller scars, less pain than standard open operations.
Our surgeons aren't the only ones who appreciate what robotic surgery can do.
One of my favorite patients had a perforation of her esophagus and went to another hospital. Unfortunately, the first person didn't get it quite right, and she came to me in the middle of the night, extremely sick. We did an emergency operation, and she has been well ever since. And she makes unbelievable cookies and brings me and the staff cookies on a regular basis.
Northwell Health. Look north.